If you're one of the many people out there with a family member who struggles with dementia, you might be in need of a break, but a break can be a real luxury. However, there's a relatively new program out there, and it's designed just for you to give you a respite. There are certain eligibility requirements, and we're going to talk about today. So if you want to know more about that, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Howard Stein of Home Helpers. And good morning, Howard. Thanks for being with me.
Good morning, Andrea. Always a pleasure to see you.
I always enjoy speaking to you because I know that there's always something that I'm going to learn. And if I'm going to learn about it, so are the listeners. So today we're talking about this new program, and it's called the Guide Program. And I'd like you to share what that means exactly.
Happy to. The Guide program is a brand new program that was just rolled out for Medicare people that are using Medicare Part A and Part B. It's an 8-year pilot. It just started last year. And essentially, what it does is it provides free coordinated care navigation. We'll talk a little bit about that and care support services like education and respite care, which is a piece that I provide. It also provides access to community providers, and the focus is on dementia because one of the things that the folks at Medicare are really trying to do is figure out ways to provide better care to those folks that are suffering from dementia. And, as we know, dementia does not only impacts that person, but their immediate family, the caregivers, and everyone around them because it is such a difficult disease to deal with.
And what I didn't realize is, well, of course, if you have someone in your family with this, and this is your situation, a break is essential to be able to even just go do your go grocery shopping or, get out of the house. But it's not always easy to do that, and it can be expensive, right? To find
Yeah.
someone to
Yeah,
help you.
it's definitely expensive. I mean, we all know that the costs of care these days have just gone straight through the roof, and that's one of the reasons why I really love this guide program because, as you know, most of my clients are private pay clients. I do have a portion of VA paid benefits to our veterans that I'm also very proud of, but the guide program is specifically for Medicare Part A and Part B only, okay? But if you qualify for that, meaning that the person that's going to be cared for meets the criteria, they aren't on hospice, and there's a few other things they can't be in the PACE program, or not living in a nursing home, you can qualify for up to it's roughly $2,600 worth of benefits with no out-of-pocket costs. And that um, basically translates to about 72 hours of respite care that could be provided to that loved one. Now, when we talk about respite care, you can leverage that in a lot of different ways. I mean, the idea behind respite is that so that that primary caregiver,
Yeah.
whoever that may be, actually gets a break. But you can, use that to support additional hours. Or if, there's a situation where, maybe there was a hospitalization or a fall or something like that where you need that concentration of hours, we can be creative and think about ways to support a family in that way. Of course, it's always centered around that dementia patient that meets that criteria. But the idea is that we can really help not only that patient with all of the additional support that the guide program is going to provide. And there's a lot of connectivity to other providers, but specifically be able to come in there with a wonderful caregiver that meets all of our standards, right? So, a certified home health aide. They have the training, nurse supervised, all of those good things that come along with an agency caregiver is going to be able to come into your home and take care of your loved one in the right way with a dementia focused program.
So, Howard, we didn't explain specifically what does GUIDE stand for.
It stands for Guiding an Improved Dementia Experience, and it's a specific model that they came up with. And again, it's around focused care to solve a specific problem for dementia patients.
So one thing we've certainly talked about many times, and working at SCAN, we fully understand the importance of giving the caregiver a break, because
Yeah.
who's going to care for the caregiver if something happens to you? So I can see this being an absolutely essential program. Unfortunately, they've only, why did it take this long for them to come up with it? But at least they did.
Yeah, sometimes it's good that we just get there, but and it's
Yeah.
not. So respite could be we do a lot of respite type of programs because it is such a prevalent problem. Caregiver burnout, um,
Yes.
sandwich generation, right? They have the young kids and the older moms, so we see that very often. But what I didn't have in my toolbox was access for people that really necessarily couldn't afford the private pay care. It was always just a little bit out of reach, and now there's an option. So we really love the opportunity to be able to uh, get to more people with some help.
Right. Now, you said this would give you as much as 72 hours.
Right. And the hours have to be like scheduled in 4 hour increments. That's just how the program works. So if you
Mhm.
think about how we can roll it out now, in some case, if you wanted to do 8 hour increments, if you wanted to, if you needed 2 weeks of full-time care, right? Like a situation like that could work. Or maybe you're just doing it on a specific day because that's the day that, you need to pick up your grandkid, or that's a day that you have a long day at work, right? Or that's the day you have to go into the office. So think about like all the potential combinations of how we can package that. And then, we work with our families to figure out how to implement it best for them so they can actually get that respite that's required and needed.
How many times in the course of a year can you take advantage of this program?
It's annual, so you can use those 72 hours every year.
Okay. Okay. I just think it's a wonderful opportunity for people. I mean, maybe you have a wedding to go to, or just an event that you just feel like you don't want to miss, but you can't leave your loved one at home. So this is a great opportunity. Howard,
Yeah.
how will they access this? What do we need to do to make this work?
So we do have some information on the website, but the best thing to do, as always, when you have a question about home care or any of these services, is give me a call and let's have the conversation. I can get you quickly qualified, usually same day, and then we start the process. Now, what's really important here is it's hard to implement this as an emergency. So we want to be as planned as possible. So we
Got it.
do need a little bit of runway to get this started, right? Because like all care programs that we're going to implement, it still requires a nurse come do the assessment. And then we want to make sure that we match that the assessment needs to the right caregiver and the personalities and the schedule. So all of that takes a little bit of time to put together. So we do want to allow for that. So the sooner you can get to me when you have an emerging situation, the better it's going to be. Or if you just have questions about the program, feel free to call me up. I'm happy to talk to anyone, especially our friends at Scan.
So all of Howard's info, of course, will be in the notes, so you'll have no trouble reaching out to him. So here's a question I'm thinking other people would have the same question. I know that at some point I am going to want to take advantage of this program, but I don't have a specific day in mind just yet. would it be the right thing to do is to call you and get everything set up so that when the time comes, I
Yeah,
can
we
say,
could, I mean
okay,
that's appropriate to do. I think it's good to just get qualified first.
yes.
That's really the first step. So can you qualify for it? And then we can talk about ways to, utilize that benefit.
So how obviously people have been using this because it's been around for about a year now. So what are the reactions from some of the people that are taking advantage of this wonderful service?
Well, I mean, I think one, it's thoughtfully designed. And the thing that I really appreciate about it is the additional support, right? And we often talk about this, about the education, right? And the resources available. It's just another set of resources with with a real care management component around it so that you can really with a focus on wellness, and that's what they're trying to do, right? They are trying to keep your loved one healthy, out of the hospital, safe in their home. We want to reduce fall risks. We want to identify issues early. And when you have those resources and when you're engaged with a set of good clinical resources, we know that the outcomes are always better.
Yes.
And as a home care company, right, what I can comfortably tell my patients is that when you have a nurse, right? And when you have someone that you trust that actually knows that loved one and is with that loved one, we start to observe things, right? And we see changes. And then you can add that clinical component. So maybe the nurse will have a suggestion or a recommendation. But then on top of that, you have a real clinical care management program with clinicians and doctors and support that actually is dementia focused, imagine the better care that can be provided. And I of course am a firm believer that when you have boots on the ground in someone's house, that the
Yeah,
attention is significantly higher than someone who maybe doesn't have that. Right now, look,
definitely.
it's true that home care is not for everyone, but there are, of course, a time in everyone's life when they really need it, and it's a necessity.
I think this is also delivering peace of mind for the caregiver because now they know that they can do something that they need to do. Maybe they wouldn't be able to get out of the house, and you're nervous about who's watching over my loved one. So I feel like this is a win-win for everyone. I can't imagine not taking advantage of this if you're eligible to do so.
Yeah, and especially this time of the year, I think is also
Oh yeah,
tough
yeah.
for our dementia patients because with the sundown and with the shorter days,
Yep.
that's always becomes a challenge with the holidays and some, unfortunately, isolation is also becomes depression, things like we have situations like that. But then the cold weather and the ice and the snow and like then what, so all of those things, I think this is a very timely conversation to have. And, let's discuss the benefits of what this could potentially do for our families.
Definitely. Howard, thank you so much for sharing the information. And again, anyone with any questions whatsoever, not only does Howard offer the guide program, he is an excellent resource for so many questions you might have. So I think you should feel free to call Howard for just about any questions. He would always steer you in the right direction, even if he can't manage your situation. You know people.
Yeah, well, and I'll say this in close and appreciate that. There are a few good programs if home care may be out of reach for you, private pay. Of course, we're always easily able to accommodate private pay. But now with this Medicare guide program, that's, I think, more access than people have had in the past. So we really applaud that. I'm happy to talk to you about that. But I also don't want people to forget about the veterans programs because oftentimes they do. So this is just a little bit of reminder about the VA community care, right? So if you are a veteran and you have a VA doctor, you can get access to private pay care like me with no out-of-pocket cost that's paid for by the VA. So I'm also happy to talk to you about that. And then just last but not least on the VA, the aid in attendance program. So if you are a wartime veteran, there are benefits, monetary benefits in the form of a monthly check that comes to you every month if you are enrolled in these programs. So there are many things out there that you may not be utilizing that can help you get access, can help you have better care, can help you be safe in your house. And of course, we want to help you with that. Last but not least, for folks that are fortunate enough to have long-term care, I think the mistake that I always see there is that they use it late and they never get the full benefit. So if you have a
Oh,
long-term care policy, don't be afraid to reach out to me just to talk about it, how you can implement it, when's the right time for you. It's never too early to start having those conversations and plan because what we don't want to have happen is a fall or
right.
something
Yeah.
worse, right? When you have a benefit like that, especially long-term care insurance, because you put so much into it, and I want you to get that benefit out of it. So happy to talk to people about that as well. And thank you so much for the opportunity to share this great new program with our friends at SCAN.
You know, we always say at SCAN, a resource has no value if you don't know it exists. But I think, Howard, you just opened up a world of opportunity for many people out there, and I hope you'll take advantage of this and give Howard a call. Howard, thank you so much for being on the show today.
My pleasure, and talk to you all very soon.
Remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Howard.
Bye.